Hi, it's Larry Potsabinski on the subject of schizophrenia again. Uh, in the TV we get these days a lot of advertisements for tardive dyskinesia drugs. There's two on TV. Austedo is the XR is the one I take, and the other one I can't remember the name, Imprezo or something. But either or, the Austedo works fine for me. But what is tardive dyskinesia, though, and why do we need this drug for it? Well, it occurs in approximately 30% of people who take antipsychotic drugs, especially the first-generation drugs, the old drugs like Thorazine, level, range, timeline. From then till tardive dyskinesia was discovered in 1964. Antipsychotic drugs were just in use for 12 years at that point, or 10 years. 10 years, I think. So it's 54. It became available in the United States. And before that, there was no hope for chronically mentally ill. But, those work to calm the symptoms, but they damage the nervous system. The earlier drugs were the worst for this, tardive dyskinesia, which is the burning away of the nerves from the extremities, the hands, the face, the feet, the extremities. Neurologically dissolves the nerve endings and erodes them in. And then when you quit taking it, it covers up the damage it does while it does it. And when you quit taking it, then you get involuntary movements. Or you can get involuntary movements from being on medication too, is to have involuntary movements occur. Jerking, twitching sensations and things in your body I used to have. And on the surface of the skin, the nerves burned away or returned by the Austedo, and I can feel like with the top of my skin again. So that's what tardive dyskinesia is. And why do you get it? You get it from taking antipsychotic drugs for schizophrenia or psychosis of some kind. And but it's not that don't not take your drug for that because you need to have, if you have an illness, be on medication, or all hell will break loose. But you get really sick and endanger yourself and end up in an institution or hospital somewhere, or worse. So don't play with those medications they prescribe. Listen to your doctor, but reason with them about tardive dyskinesia. 30% chance of people, chance of everybody who takes it, antipsychotics getting tardive dyskinesia. So there's a treatment for it now. It was considered permanent all these years, but in studying the treatment I was on, I discovered there are other tardive movement disorders caused from antipsychotic drugs, and among them tardive dystonia causes scoliosis, which is the curvature of the spine that I have. It corresponds with different profiles I read. Pizza syndrome, PISA, like Leaning Tower of Pizza, and your back is curved and it's out of place, and it hurts very much at times. So I can't do very much before without hurting, so I have to have help, and I get help, and because this wasn't my fault, man. I was fed those drugs, and they didn't even know. But there is hope, though, for the future. There's a fourth generation antipsychotic drug now. It works on total different brain chemistry in the brain than traditional antipsychotics. Work on dopamine and serotonin brain chemicals that become too high and causing hallucinations and delusions. They lower those, but they cause brain damage in the process. And tardive dyskinesia, tardive dystonia, tardive Parkinsonism, and there was another one too I couldn't pronounce. But tardive movement disorders caused by antipsychotic drugs. Ask your doctor or psychiatrist about that subject, and don't let them intimidate you. You have the right to know. If you can't figure it out, find it on Google Scholar Search is where you look. Google Scholar Search, find that, and type in schizophrenia, tardive movement disorders, antipsychotic drugs. Is all you gotta do. So, well, there is no undoing the tardive dystonia scoliosis curvature of my spine. I have to live with it, and it's very hard, awkward, and painful a lot of the time when the pain shots wear off like they currently are. So I'm on medication, thinking they could get me scheduled. They were supposed to schedule me, and they haven't. So I need to get on that next week. It's a weekend now. So, okay, but tardive dyskinesia, yeah. So these other tardive movement disorders go in with that antipsychotic drugs. So what's your choice? The fourth generation I was talking about works on. It's in long-term trials in Washington State, Seattle area, Oregon up that way. They're in long-term trials with this drug, Cobenfy. It works on acetylcholine in the brain instead of serotonin or dopamine. Totally different approach to treating the illness. I was hoping that there won't be brain damage nerve damage occur from the use of antipsychotic drugs, typical antipsychotic drugs, atypical ones too, the second generation and third generation. That one profile with Abilify or Piprazole added for risperidone. It was a specific profile, and then when that was added, that was when my back problems began. But nobody knew to watch for that happening, because the government knew, and the National Institute of Health and the FDA and the American Psychiatric Association all can kiss one. But just because you knew and you didn't tell doctors, you use these drugs to gauge people for it because it's reversible. My left shoulder dropped initially, indicating a curvature of spine in my back. And if that was no spot and the doctor knew to gauge me for it, they would have stopped it, and it wouldn't have crippled me up the way I am now today. I can't walk more than 300 feet without stopping. So even that. So I'm homebound, and this is because of antipsychotic drugs. So that's what I'm saying. It's a public service announcement. Warning: if you take them, talk to your doctor about minimizing any kind of tardive dystonic scoliosis effects. Be gauged for that by your doctor. Ask him. They just have to look. All they do is look at your back, and they can see the curve in it or not. So you just have to talk to your doctor. But that's all I can tell you about this for right now. It's a serious problem. It's not to be taken lightly. So thank you for watching. Peace and love, and have a good day.